Baltimore City's Healing Act now in effect, which means officials will have to undergo trauma training to better respond to people's needs. WMAR 2 News' Dave Detling has more tonight from City Hall.
Well, under this law, local agencies will have to take trauma training so that they can effectively treat and respond to trauma. Talking to one Baltimore family impacted by murder, they say if you have to take a class, you simply don't understand.
I found in her room, my daughter's room. It was her.
Rosanna Paz wearing her daughter's ring. It's a way to keep Nayeli close. It's been nearly 2 months since her murder. She was shot and killed in a road rage incident. An innocent bystander, she's one of Baltimore City's homicide cases that hasn't been solved.
It's a hard time trying to stay strong for my other kids, you know. It's so hard every day. The first thing in my mind is her.
The family knows trauma and loss. Nayeli's sister, Yami, says aside from 2 teachers reaching out to her and a BCPD detective answering family phone calls, there's been no type of trauma outreach or resources offered by city agencies. Like many Baltimoreans impacted by violent crimes, the family feels city leaders don't understand their needs.
I honestly don't because if you haven't experienced it, then it's just, you just can't imagine the pain, you know.
Mayor Brandon Scott says that will change. Today, his administration issued policy guidance requiring all senior level cabinet members to be trained in trauma-informed care.
We're talking about systematic change, and I'm let the health commissioner address further, but we're talking about having city agencies and their employees be trained in something that they have not been before, because we have not, as a city, understood the deep impacts that trauma has had on the city.
Known as the Elijah Cummings Healing Act, the law will make sure city government knows how to effectively respond to and treat trauma. The legislation also authorizes a task force to develop a citywide strategy to address trauma and life issues associated with it. Health leaders say this is a new plan to healing the city.
Many times it's frontline staff, and yes, they interact with the public, but when it starts from the top down, I think that that's really important in addressing the root cause and also stressing the importance of trauma-informed care approach when we approach constituents, when we approach each other.
The training is expected over the next 30 days, but for the Paz family, they say the understanding comes a little too late, as they're already planning to move out of Baltimore City, taking their pain and loss over Nayeli with them.
I don't know what's going on with the city. They don't do anything. They don't tell me anything. It's almost three months.
And according to the city, these trainings will be overseen by the health department in partnership with local organizations. Outside City Hall, Dave Detling, WMAR 2 News.